Okay, this is Mr. Aloha. He is 74 years old, male. He has an allergy to crab and shellfish. He is in room 202. He was admitted on 10/25 for shortness of breath persisting for 4 days. He is a full code status. He is on MRSA contact precautions. His support is his wife, Mrs. Aloha. He has a past medical history of SVT. He has a pacer, BPH, CHF, diabetes 2, sick sinus syndrome. His diagnosis is respiratory failure due to end-stage COPD. His neurostatus: he is ANO times 3. He has a RAS of 0. He has a GCS of 15. His pupils are perla at 3 millimeters. He denies any pain, and he has strength 5 out of 5 in all extremities. He goes through bouts of desatting, and he needs calming and reassuring, so he is prescribed Seroquel. Today, the PT stood him up only briefly because he is sensitive to exertion and desats quickly. Cardiovascular: he has a pacemaker. His heart rate ranges from 70s to 90s. His blood pressure is usually high in the morning, usually around 140 to 160s. He has good pulses, 2+ in all extremities. Respiratory system: he has coarse crackles throughout all lobes. He is on MPPV. We weaned him off of it on the nasal cannula, 2 liters, but we had to put him back on NPPV at 10/5 with FiO2 28%. He's on a home nasal cannula. He has a productive cough, and he has PRN breathing treatments. GI: he is NPO except for meds because he did choke on rice yesterday, so he does have a swallow eval scheduled. He has had no BM since admission, so we treated with Miralax and Senna. He is positive for gas, and his abdomen is soft and non-tender. GU: he has a Foley, which may have trauma to it from his altered mental state upon admission. His urine is brown with sediment, and he has good output over 100 mLs per hour. He has 1 IV in his right peripheral arm. His skin: he has some bruising all over his arms, but his back is good. Labs: we did ABGs, which were all within normal limits. He's on glucose checks, and we treated 1 time today when his glucose was 212. His plan for the day is to get out of bed, watch the ACP video, wean from the MPPV, and most importantly have a discussion with his family about palliative care or attempting to go home on his Trilogy breathing machine. That's it. Thanks. Have a good shift.